Medical documentation. What is documentation? It's anything written or printed, relied on as a record of proof for authorized persons. It's a vital part of the professional practice. The purposes of documentation is the quality of care, which provides evidence that care was necessary, describes responses to care, describes any changes made in the plan of care, and then the coordination of care is planned interventions, decision making without ongoing interventions, evaluation of patient's progress, and used by all team members. The purposes of documentation in medicine. Clinical records are reviewed to ensure the facility meets the required standards, assessed for ongoing compliance. Importance of medical documentation. The proper and adequate medical documentation is essential for quality of medical care and healthcare services throughout the industry, from receiving proper and correct treatment. Who writes medical documents? Medical documentation, or documentation of a medical condition, means a statement from a licensed physician or other appropriate practitioner providing information the agency considers necessary. Documentation increases patient care. Medical record documentation is required to record pertinent facts, findings, and observations about an individual's health history, including past and present illnesses, examinations, tests, treatments, and outcomes. The medical record chronologically documents the care of the patient and is an important element contributing to high-quality care. General principles. A. The medical record should be complete and legible. B. The documentation of each patient encounter should include reasons for the encounter and relevant history, physical examination findings, and prior diagnostic test results, assessment, clinical impression or diagnosis, plan for care, and date and legible identity of the observer. Ethics and documentation. Adequate medical documentation assures patient confidentiality and ensures that standards of care are being met. Doctors and other medical personnel have an obligation to treat patients to the best of their ability in regard to information documented in a patient's record. Patient's healthcare information, a vital document. The patient's history is a vital piece of information that enables physicians to determine the best diagnosis and treatment plan for that individual based on information found in the medical record. The medical record must contain subjective history, that is, past medical history, which is medications, allergies, illnesses, the doctor that saw the patient, surgeries, allergies, events leading to illness or injury, or last oral intake, any personal past history. Common standards for documentation is the assessment, plan of care, medical orders, the progress notes, and the discharge summary. Some of the skills used in documentation is cognitive, technical, and interpersonal, ethical, and legal. Good documentation increases legal protection, such as peer review, requirements for reimbursement, legal protection, research, and continuing education. Patient records helps in planning your future actions. Communication, care planning, quality review, research, decision analyst, education, legal documentation, and reimbursement. Patient records are confidential, so do not discuss them without purpose. Correct your mistakes with sense and legality. Never use a whitener, never scratch out, draw a line through the mistake, and initial above the mistake. Legal aspects of charting. Do not erase, do not white out, or scribble out errors. Do not write retaliatory or critical comments. Do not place blame on your colleagues. Correct all errors promptly. Spell correctly. Record all facts in objective terms. In order to prevent legal problems, record everything you do, including the phone consultations. Apply guidelines. Learn from your seniors or consultants. Don't use erasable pencils, and don't use humiliating expressions. Medical billing and coding needs documentation. Without adequate medical documentation, your healthcare providers might not be reimbursed for providing you with care, leaving you stuck with the bill. There's an old saying in the healthcare industry: if it's not documented, it didn't happen.